Dr. Carmen Kynard is the Vice President of Nursing Services and Performance Improvement for Strategic Behavioral Health. Dr. Kynard was previously the Chief Nursing Officer for an acute-level multi-site behavioral health care hospital for 17 years. Prior to doing so, she served in nursing, hospital administrative roles in the San Francisco Bay Area. She is a certified hospital risk manager. She has served on the board of Malcolm Baldrige Examiners. I need to talk to you. When not working, Carmen is performing medical mission work. Pursuant to this interest, she returned to school and obtained a doctorate of nursing practice from Creighton University, Omaha, Nebraska, to become a nurse practitioner.
Well, good morning, National Black Nurses Association.
Good morning.
My name is Carmen Kynard, and it is my pleasure and honor to be here today to speak to all of you about that whole topic of building a culture of health in our society. Now, my perspective of it is a little bit different than what we've had so far, and then I'm going to focus on building a healthy workplace, building that within our environment. Now, I must say, when I was first approached by Dr. Gorham about this presentation on building a healthy workplace, I thought, are you kidding? I'm not exactly the poster child of health here. But what I do want to say is that we are all on a journey towards better health. And so I'll talk to you a little bit about some of the things that we're doing within my own specific organization, which is Strategic Behavioral Health. First, just a little bit about strategic behavioral health. I'll give you a little bit of insight into our mission and vision. Now, behavioral health is not a misnomer. This is a psychiatric company. Our focus is on behavioral health. And one of the things that led me into nursing, because I came from critical care nursing, but I was in the Berkeley, California area back in the 80s, and I was right by California Berkeley campuses, by that university. And one of the experiences I encountered is that you would, and if you know anything about Cal Berkeley, it's a very competitive school. And so we'd have these students that had been excellent in their smaller pool of students. They would join Cal Berkeley, they'd get a C for their on a test for the first time, they'd jump out of the dorm and try and commit suicide. Yeah, sadly, also, I dealt quite often with individuals that had survived bridge jumps from the Golden Gate Bridge. And if you know anything about the Golden Gate Bridge, it's considered the site for the highest rate of suicides in the world. And so I tell people that in working in critical care, I got too tired of chasing after gurneys and telling patients, wait a minute, let's put this in perspective after we patched them up. You got a C on a test. You've got your life ahead. You're 18 years old. What can we do about that? And so I decided I needed to get further upstream in working with a whole mental health spectrum. So back to strategic behavioral health. Our vision and mission are as follows. First of all, helping families put their lives together, back together, one piece at a time. Strategic was founded in 2006, and so we just celebrated our 10-year anniversary. And our mission is to provide compassionate, highly effective mental health treatment options that are utilizing a collaborative team approach to care in the most appropriate setting to that individual and to the communities that we serve. As has been mentioned and illustrated, we are a tapestry. We are a changing community, and so we have changing needs. And so that's one of the things that I like about strategic behavioral health is that we have something for everyone within that whole scope of services that is needed. We have 10 hospitals across these states. We are building another one that's in Wisconsin. We service all age groups, children, adolescents, and that's always saddening to me to know that there are young children with strong mental health needs in our communities, but they abound prevalently. So adolescents, children, adults, senior adults, we work with active duty, retired military to work with their needs because many of them are returning with complex PTSD, post-traumatic stress disorders, and things that we are contending with. We service inpatient care, the partial hospitalization program, which is a program when patients will come at 8 in the morning and stay to 2 o'clock in the afternoon. Intensive outpatient, which involves coming after work for about 4 hours. And we even have psychiatric residential treatment options. Now, so please check out our exhibit that will be in the area later on this afternoon. We need good nurses like yourselves, and certainly if you or yourself are interested, or if you know anyone that's interested in mental health care from a caring or serving perspective to a patient perspective, check us out. We're happy to help. So let's talk a little bit, as we're talking about building a healthy workforce, in terms of where has nursing been? And I wish I had some music playing right now. The Way We Were, that Barbra Streisand song comes to my mind here. Where have we been? The Way We Were. Now, I can't see fully everyone in the audience, but was there anyone in this audience that had a nursing cape, that came from that generation where they had a nursing cape? All right, okay, very good, I love it. Had some nursing capes in the background. Very good. Now, also, how many of us graduated and we had the capping ceremony and we got our caps? Yes, absolutely. I was from that nursing cap era myself. I too am a baby boomer. And so with that in mind, I hail from Kansas City, Missouri, even though I work out of Strategic, which is based in Memphis. But I will say, as a quick aside, when I graduated from Creighton undergrad, something said, go west, young woman, and I wanted to live in the San Francisco Bay Area, and so I moved there, ended up living there for 15 years. But I remember my first day, I went proudly walking in there with my nurse's cap and my little plastic bag, and they looked at me like I was from another planet. It's like, what are you doing, lady? And like, we don't wear those here. And so I had to tuck it aside there. But again, this is where we were. Now, I pulled up some pictures of some of the things that we endured as nurses back in the day, shall we say. And with that in mind, one of the things that I want us to just summarize in terms of the way we were, these were some of the conditions in which we worked. And one of the things I'll be talking about is to see, have we really strayed that far from some of the conditions that are still existing, perhaps? Now, we worked long stretches of work days back in the day. Do most of you admit to that? Now, I had a former boss, and she never did this to me, but I observed it many times. She was very passive-aggressive, and this was working in the critical care unit. And she became angry with you. She wouldn't tell you. She wouldn't talk to you what you did wrong, but you'd get a long stretch of 12 to 14 days straight before you had a day off. So we all knew when she was mad at one of us there for that. We had heavy patient loads. Now, it's not to say today that nurses don't work hard for their money. I totally agree and get that and see that. But how many of us would have an entire half wing of patients, the entire side of a unit? You know, sometimes now in nursing, we get upset if we got more than 10 patients or 15 patients. You know, it was unlike that in those days where you had a unit sometimes. We often worked despite illness. We would come in there sick as a dog and work. And finally, we've heard that message that the flu is transmittable to patients and ourselves, so that we don't wear suits around that, and that it's better to stay home in those conditions. We had little or no occupational health access. If we injured our backs or such, we were pretty much on our own in terms of improvements of that whole process. Now, I will say, I think I had my first back injury, which I just kind of nursed myself back together at none other than age 22. Bad body mechanics, leaning over, remember those old commode chairs? And helping pick up a patient, a craniotomy patient, and somebody lost grip, and so I'm leaning over the chair holding this man at a terrible, terrible angle. So more reason for healthy workforce environments, which I'll be talking about. There was an absence of PTO systems, paid time off systems. Now, it used to be that you had your pool of illness days and your pool of vacation days. Never the twixt and two shall interface. And when I worked in critical care, and I believe I was in my master's in education, human services, I was working on that at the time. I did a little study with ICU nurses. How many of you take, quote, mental health days, when you're not really sick, but you're taking that day off because you need a mental health break? Yes, you know, it was almost universal. We all did it. And so it was so nice in moving forward how now most places do have PTO programs. Now, we didn't have the health and wellness mechanisms that we now have, and we were pretty much all on our own as relates to self-care and health improvement. As I mentioned, we took care of ourselves. So we made a lot of progress, right? Or maybe not. You know, are we not far from some of these same conditions there that do exist within nursing, but that we've got some better mechanisms, is what I say, in terms of contending with them? We still have physical wear and tear on ourselves. And let me talk a little bit about impact of physical wear and tear on individuals. They say that more than 35,000 back and other types of injuries occur per year per nursing staff that will cause them to lose at least a day of work. This was taken from the Department of Labor, Bureau of Labor Statistics. But I also read something about this, very similar to this, in the Journal of Neurology, where it said the #1 profession for back and neck injuries is not construction, but what? Nursing, absolutely nursing. And besides the physical wear and tear, we've got the mental wear and tear. Again, you know, I'm work in behavioral health care, so I care about our nursing mental health care needs. And so let's talk a little bit about that. What's that impact of mental wear and tear on people? Now, this was an interesting study that I read about, and essentially what it says is that, well, there's all sorts of reasons why nurses go into nursing. How many of us in this audience went into nursing because we wanted to help others? Okay. Anybody in the audience that wants to fess up that they went into nursing because of the money? No? Okay, there we go. Someone in the audience. All right, no problem with that. Now, it's said to each our own there, but an interesting phenomena is that those of us that went into nursing to help others have a higher burnout rate than those that went into it from a business perspective. And reason being is that in nursing, with these decreased lengths of stay, we don't see the outcomes oftentimes of our patients. You know, we don't see that full point of recovery, or what's the end of the story. For instance, in behavioral health, all we know is the person stabilized out, didn't successfully kill themselves, and they're responding to their meds. But we don't see those other aspects of it. And as I always say, in behavioral health care nursing, we don't release people with bundling little bundles of joy there, where they're going out of a maternal child clinic with a newborn baby. It's like, phew, I made it through this one, and what's next for us? So here's some more problems there, and why we need for intervention through wellness and prevention. Work schedules. Now, one of the new phenomena on the block, of course, and I guess it's not so new anymore, are those good 12-hour shifts. Any of you in the audience work 12-hour shifts? Yeah. Okay, and some of us even stretch ourselves beyond that and work 16-hour shifts. Anybody? Yep. Okay, and I think back in my heyday, I probably did some 16-hour ones, but I always cringe when I see that, because there's study after study that shows that we are not in our prime in terms of caring for the patient most effectively, but also there is more job dissatisfaction associated with working longer shifts. That was very surprising to me, because you hear about the nurses that say, I want to work 3 12s and then I want to be out for 4 days. Well, yes, but is all I can say to that, because there is some association with more job dissatisfaction and job burnout in those situations. So we need to talk about what's that impact on us. And with that, I say, nurses, sometimes we talk with our feet. We might not say a whole lot on that exit interview, but we talk with our feet. And there's an exodus in general from the bedside nursing and nursing. So further, what's that impact on us if we're not taking care of ourselves there in that regard? The alternatives abound. I did a little Google in terms of what other jobs besides nursing, and these just popped up just immediately. 15 super non-hospital nursing jobs. Want to leave nursing? Here's some advice. Non-clinical nursing jobs, 5 alternative jobs for registered nurses, alternative careers for nurses. So we've got some competition out there that are ready to take us in our workforce as a result of that. Which brings me to, why else should we be concerned about a healthy work environment in hospitals? It's not only that business perspective, and I apologize for those of you where I've had to you've humored me through this whole process of talking about it as a VP of nursing, but from a personal perspective with our employees that we're taking care of, why care about healthy work environment? Look at our first leading cause of death that still exists in the USA population despite all that we've done. That was captured by Dr. Bolton and mentioned by our other presenter, Ms. Patterson, that heart disease, leading cause of death. That exists among our employees as well. They don't have bulletproof shields there that prevent them from developing heart disease. And secondly, there's cancer, which is another second high cause of death in the U.S. Oops, I skipped that one. That third one, of course, is the lung diseases that we see. But this is a sobering one. Suicide is now one of the top 10 causes of death in the United States. Very sad reality that we see in terms of it being in that top 10. And so with that in mind then, I want to say something real quickly about suicide. I did a research study looking at causes of death within professions. And this was an older study. I didn't have a more recent one, so I didn't make notation of it here, but it talked about nursing as having a high suicide rate in its profession. That was very surprising to me. So here's another reason. We made mention of the impact of diabetes on us. And as a nurse practitioner, I can't stop it to say in showing you this, that there's over 24, 25 disease states that are caused or that are complicated by diabetes. So moving right around then, how can that healthier workplace benefit us? Some 67% of employees said that their own participation in wellness programs increased their engagement in their employer's mission and goals. So looking at it from the hospital business perspective, you get that more engaged employee if they're being better taken care of. 91% of employees that were participating in wellness programs state that they improved their fitness, while 81% said that they improved their overall happiness and well-being. So you've got a happier, healthier employee that will deliver better care. So other ways that this can occur and can benefit us is that 44% of respondents talked about stress management. Again, I'm looking at the whole issue of mental health management. And 44% of them said that the single most effective way of establishing a culture of wellness is to get at the mind, the stress management piece. Now, there's only about 14% of employees that participate in our mental health programs across the board, but 71% of those do talk about the advantages of it and how it has impacted and reduced their overall level of stress. And all of us know the damaging effects of stress on our bodies, do we not? That just the sheer reduction in ages of years, the reduction in our immune system's ability to fight off and ward off some of the problems there. So now let's talk about our components that are needed then for a healthy work environment in hospitals. And this is a compilation that was gathered in a presentation of the American Hospital Association by, interestingly, a former neighbor of my parents' area. But when you look at this graph and you see the things in blue, these are the different types of wellness programs that are offered in our healthcare systems typically. And when you start seeing the red, those are the lower levels of healthcare items that are offered and are available to individuals. But in looking at them, and one of the things to know that as employers, we can choose what we want to adapt. There's like a cafeteria offering of when you're signing up for these benefits at a human resource perspective of which of these do you want to participate in, and that HR individual checks those. So this just shows real briefly the percentage of hospital employees that are participating in the various programs, or at least one of them. And you see, we're still not real high in our numbers. So the last area that I'm going to cover is talking about the components of building a work of culture of health in hospitals, and then how we can meet those goals. The first one that was cited is for us to be a community role model. We need to practice what we preach out there. And the suggestion was to build an integrated program that shares risks and rewards. So not only a stick, but a carrot in participating in it. Secondly, to create a culture of healthy living by doing dashboards and posting results and eliminating environmental inconsistencies. Now, I'll give you an example of an environmental inconsistency in that we might have a weight loss program going on in our organization, and you walk in the vending room machine and you see Snickers bars and Fritos. And my downfall, when I always say that in college, I think I got addicted to these, but those packs, those coconut donuts, 6 to a package. Yeah, I've never met a package of those that I can't walk away from. And if you ever look at the fat content and calorie content on those coconut donuts, they're damaging. But if we've got those in our vending machines and we're trying to purport health, what does that say about us? We want to provide a variety of offerings, and by that, we want to have those healthy risk assessments and screening and coaching opportunities for our employees. And as I mentioned, the positives as well as the negatives in terms of some incentives. And so with those, for instance, maybe if you're at a certain BMI, you get a reduction in your health insurance premium. We want to track, well, in fact, my husband's work group, they're getting their health exams this week, and a few of them are a little bit on the nervous side and have been on diets trying to get those BMIs down before that, because they know that they can cash on a better dollar savings with their plans. We want to track participation in outcomes, because we as individuals, we want to know how we're doing and what's the result is on that. And we certainly want to measure for that return on investment. Is it off or not? Or are people working longer? Are we increasing our retention? Are we increasing our morbidity and our mortality in our groups? And we certainly want to make it sustainable, not just the flavor of the month, but that's something that moves along with that. So this really reiterates some of the things that we're doing at Strategic, but for sake of time, I'm going to go into this last little section. It just shows you our participation form that's online, but these are all the different programs that we're participating in. Of course, the vaccines, influenza, hepatitis, we're required to offer an employee in direct patient care hepatitis vaccination, and then even record if they're declining. EAP, mental health services, smoking cessation, healthy food options are in our break rooms. Tobacco-free campus. Now, oddly, you probably say, why in the world don't you have a tobacco-free campus? That's been in place for many years in med-surg environments. There's a lot of studies that show patients that are taking psychoactive drugs, the drug is impacted by the nicotine in the tobacco. And as a result, the doctor will stabilize, or nurse practitioner will stabilize that patient on a certain med dosage. And say, for instance, that we did not allow smoking on the campus, get them on one level of a med, they go home to return to their same environment, start smoking again, and it changes the dynamics of that med in their body. And so for right now, we do not have a smoke-free environment, though we would certainly like to. They smoke in a designated area outside of the building, but that extends to employees, and that's on our list to change. We have safety programs, which involve like back safety, those components. Health risk assessments are done, and weight loss programs. gym memberships, discounts for prevention and management, and of course, one of the things that is on our list for this year is to deploy across all the hospitals exercise facilities available for the employees. How many of you have exercise facilities there within your own hospitals that you as employees can use? So as you see, not a whole lot, and we look at that graph back there, it's a similar percentile. Classes in nutrition and healthy living and stress management. So the last piece that I'll end up with is, what are our challenges? And since I've had this role for probably less than a year, very short of a year, one of the things that is the factor, why don't we exercise and get out there? Time. Yes, it's the whole element of time. And it's so important to make time for ourselves, that we're our own advocate there in terms of taking care of ourselves and taking care of our bodies. And so it's time and making choices and finding those right balances. Okay, how many of you were in town last night and were able to maybe participate in or have some fun? How many of you got in town last evening at least? Or were there? How many of you were at the gym? Okay, yeah. Now, how many of you, oh, I've got a hand there. How many of you were on Bill Street or at BB King's there and eating it up? There we go, yes. And so my point is, we've got to find that right balance to take care of ourselves. And so in closing, knowing's not enough, we must apply, and willing is not enough, we must do. So I want to thank Tony Harper, who is our Executive Vice President of HR, and Paula Robilio, who is our Employee Health Coach, for pushing us on and participating in some of this. And I close with, I wish you well on your own healthcare journey, and I'll see you at the gym.